Well, every Thursday, we're taking a look at a health issue or concern affecting many people, breaking down the information for you and telling you what you need to know to keep you healthy. Dr. Kalani Brady from the John A. Burns School of Medicine joins us now with this week's topic. We're talking about osteoporosis, and it affects a lot of people.
It does.
What exactly is osteoporosis?
Osteoporosis is thinning of the bone. Now, that does not mean that if you look at bone with osteoporosis, the bone would actually be thinner. It's the matrix or the meat of the bone inside that's thinner. And that puts you at risk for fractures. And that's the risk of osteoporosis, is that you get skeletal fractures, hips, back, wrists, all kinds of fractures as we age.
And it's mostly caused by estrogen deficiency, but men can get it as well,
That's right.
Okay.
As we age, the bone mass becomes thinner, and men can get it as well. Not as common, but it certainly occurs.
And what are the risk factors?
Well, as you mentioned, Christine, menopause is probably the major risk factor. In addition to that, there's smoking, excessive alcohol, physical inactivity, lack of exercise, especially weight-bearing exercise, and poor nutrition.
Okay, so, and you said menopause, so usually you don't see osteoporosis until later in life.
Right. And then for those of us that have another problem we talked about a couple of weeks ago, asthma, if we use prednisone as a rescue on a frequent basis, that can make osteoporosis worse.
Okay, and how is osteoporosis diagnosed?
Osteoporosis is diagnosed with a history of fractures in the body, and a physical examination, and then some lab tests. Some kidney function, liver function, calcium, vitamin D, which is very important in prevention of osteoporosis, and then finally the DEXA, which is an X-ray scan of the hip and spine, the two most common areas of serious fracture, to find out how dense that bone is in those areas.
And because osteoporosis is about the bones, we often think that getting more calcium is treatment, which is true, but there are other ways that you can treat osteoporosis.
Right. Let's go through the natural ways first. Calcium, as we talked about, is very important. 1,200 milligrams a day of dietary calcium. If you're not getting that in your diet, then taking calcium pills is good. Vitamin D is very important. My urologist actually put me on vitamin D to prevent osteoporosis in me. Weight-bearing exercise, jazzercise, Stairmaster, weightlifting, running, those are weight-bearing exercises for 30 minutes 3 times a week will help. Smoking cessation, again, smoking is a risk factor for many things, osteoporosis being one of them. And then medications. There are numerous medications for people who are on their way to osteoporosis, which we call osteopenia, and then people that actually have osteoporosis. The most commonly used are alendronate, Fosamax, and its cousin risedronate. And those drugs are taken, they can be taken daily. There's a once-weekly preparation. There is even a once-monthly preparation that hopefully will reverse osteoporosis and cause regrowth of the bone. In addition to that, there's an estrogen modulator called raloxifene or Evista for those people that can't take bisphosphonates like Fosamax. And bisphosphonates, you have to stay sitting or in an upright position for 30 minutes after you take it. So if you have problems with your esophagus or if you have kidney disease, then Evista is a better choice.
Okay, osteoporosis not just in women, but for men as well. And next week, what are we talking about?
We're going to talk about depression.
Depression, okay. Well, thank you so much for being here, and Happy New Year to you.
Happy New Year.
And please get better.
Yes, indeed.
All righty.